Peace world, what's going on? It's Substantial coming to you live from Baltimore, Maryland right now. What you're about to see is an interview that was filmed on June 1st in Owings Mills, Maryland with Dr. Berg. He's the same gentleman that performed the surgery on me on May 10th last month. And as you can see, I'm still here, man. I'm doing a lot better. The recovery was a little rough in the beginning, but back to myself. He cleared me to go back to work, so I'm back to working with the kids and doing what I love to do. So I just wanted to put together this little video to give everyone a lot of useful information just about colon cancer, and also, just to encourage folks in general to, just take care of themselves and really be conscious of what's going on with your body and the different things you're doing to it. Just pay attention. On that note, check out the video and pay attention, man. It's useful information. I know it ain't the typical video you're used to seeing on a hip-hop blog or whatever, but quote Dead Prez is bigger than hip-hop. So yeah, enjoy it. Peace. So could you tell us a little bit about yourself, like how long you've been practicing medicine?
Sure. I'm Dr. Berg. I'm a colon and rectal surgeon. I'm the managing partner of Colon Rectal Surgical Associates. I've been out in practice for 24 years, and I underwent a general surgery residency and then did a colon and rectal fellowship following that. So I specialize in colon and rectal surgery.
Okay. Any reason in particular you chose to go into that field?
Well, I can't say there's any particular reason other than the fact that the people that I met that were colon and rectal surgeons, I really respected them. And I was originally going to be a plastic surgeon, and changed when I started my residency because of the people that I was working with.
Gotcha. Could you tell us, like, what is colon cancer exactly for the people who don't know?
Well, cancer in any part of the body is an abnormal growth of cells, and that has the potential to spread and to eventually kill somebody. Cancer in the colon is actually one of the top 3 cancers in the United States, and it's actually the #2 killer of people. There are about 150,000 new cases every year in the United States, and about 50,000 people a year die from that.
Wow.
So it's actually a cancer of the large intestine or the colon.
What are some causes of it?
Well, basically, most of the cases that we see are known as sporadic cancer. That probably accounts for about 85% of cases, and that is when there's not necessarily a family history, there's not necessarily a family genetic predisposition. That typically occurs at a cell level with different genetic problems that occur to the cells. They start building up, and they can have additional genetic problems that can eventually lead to a colon or a rectal cancer. Other causes would be a type of familial type situation where you have familial polyposis. That is where people have thousands of polyps. So if there's only a 1% chance of a polyp becoming a cancer, and you have thousands of polyps, then basically you have a 100% chance that you're going to get a colon cancer by age 40. That's called familial adenomatous polyposis. There's another kind called Lynch syndrome, which is responsible for 2 to 3% of colon cancers. This is a family type situation where you have colon cancers. You can also have uterine cancer, breast cancer, several other cancers associated with that, and this is also genetically predisposed, and these people typically present with more right-sided cancers at younger ages. And this is, you typically see several generations of people in the family that have this, and that gives the idea that this is the Lynch syndrome.
Right. Wow.
Let me just say, in addition, if you have inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, and if you've had it for many years, and if you have had active disease, then you have a higher propensity to develop a colon cancer with that also.
Why are African Americans among the highest group to be affected by colon cancer?
Nobody's 100% sure, and they're actually doing some studies, but clearly there's a higher percentage of African Americans that do develop colon and rectal cancer. And the recommendation is to start screening them at age 45 rather than age 50 for an average risk person. Some of the thoughts are that, you know, there might be a more aggressive gene. People are more afraid to see their doctor. There might be the thought that, well, they can't afford it. They're not having any problems. They're just not going to go to the doctor. Right. They might be afraid to do the colon prep, something along those lines. So they're not 100% sure why, but the evidence is bearing out that there is a higher propensity in the African American population.
Wow. How does diet play a role, if at all?
Yeah. Diet does play a role. Exercise, proper diet, which is eating plenty of fresh fruits and vegetables, drinking plenty of fluids, staying away from smoked meats, no cigarette smoking. Cigarette smoking clearly has an impact on any cancer, but especially colon cancer. And obesity. There's a higher incidence of colon and rectal cancer in obese patients. So lack of exercise, things along those lines, tend to be associated with a higher incidence.
What symptoms should someone look out for?
Well, here's the thing. The early symptoms of a colon or rectal cancer or a polyp is basically nothing. So people are walking around, they're not having any problems.
Wow.
Late symptoms would include rectal bleeding. It could include a change in your bowel habits so that all of a sudden you're going more frequently than you have always gone. There can be a change in the size of the stool. If a tumor is down low, it could be blocking part of the passage, so it could thin the stool out. The crampy abdominal discomfort, so new onset of constipation, new onset of diarrhea, those are things that you look out for.
What about like colon cleansing? Is it good or bad for you? Does it help in this case, or does it have no effect?
There's really no evidence using prospective randomized control trials that colon cleansing does anything.
Okay.
I know there's a lot of advertising out there that food gets stored in the colon, you can lose, you have 20 extra pounds or something like that. That's all absolutely not true. And you can ask anybody that's had a colonoscopy, because you have to do a bowel prep in order to clean the colon out. And the most you lose is maybe about 3 to 5 pounds.
Right.
Nobody's losing 20 pounds, and you're getting a completely clean colon. So it's really a fallacy. I think that as long as you maintain a balanced diet, drink plenty of fluids, eat plenty of fresh fruits and vegetables, that you should be in pretty good shape.
How do you feel about fasting? Is it important that people fast? Should they try to do it more often?
I'm not a nutritionist, but I don't think there's anything that fasting is going to actually do to promote anything that's positive in the body.
Okay. Lastly, I just wanted to kind of talk about the procedure that I had recently that you performed. What I guess prompted you to feel as though it was important that I take preventative measures in this particular case, although there was no evidence or whatever that that it was definitely cancer, but it was still, you still felt as though we should perform the procedure anyway.
Well, in your particular case, you were followed up by a gastroenterologist who found this flat, benign polyp over in the cecum, which is the very beginning of the colon, and the cecum is where the small intestine meets the large intestine. In addition, it appeared that the polyp was growing down into the small intestine. So this is a fairly thin area of the colon, so if you try and be aggressive in removing the polyp, there's a higher incidence of accidentally putting a hole in the colon there. So because of your young age, and because we knew we could do this minimally invasive laparoscopically, the best thing to do was go ahead, get it out, and be sure. The other thing is that anytime you are taking biopsies of a polyp, it's only samplings. So that is not a 100% guarantee that you're finding exactly what's going on in that polyp.
Right.
So they're just teeny little biopsies that go through a channel of the scope, so it's certainly possible that you can miss some cells that might make you change your mind.
Right.
So that's the reason why we did that, and I think that it was a smart move, and luckily everything turned out to be completely benign, and you don't have to worry, you know. So the last thing I want to say is I touched a little bit about screening. I think that it's very important for people to get screened. Screening does two things. It prevents a cancer, because if somebody has a polyp, which is typically a precursor to a cancer, in other words, the polyp can grow into the cancer. It doesn't happen overnight. It can take several years. But if you remove the polyp, you're not going to be able to have the cancer. The other thing is, as I told you before, is that when somebody is symptomatic, either with a change in their bowel habits, bleeding, things along those lines, that's typically later on down the curve. So what you want to do is find somebody while they're not symptomatic, and that way, typically, if there's a cancer there, it's earlier in the stage of it, and the earlier the stage, the more likely that you're not going to have any spread to the lymph nodes or anything like that. So you won't need chemotherapy. Okay.
All right. So yeah. So I guess if there's nothing else you wanted to say, I mean, definitely thank you for your time. I do realize you're a busy person, so I appreciate you taking the time to talk with me and also share this information with the world. So thank you
very much.
All right.